So next, coming to the clinical manifestations. So let's talk about the respiratory tract. Even the anterior nares can get affected. From the anterior nares, the pharynx, tonsils, larynx, anything that can get involved in the diphtheria. So most often we see the membrane over the pharynx or the tonsils. That is the most common location of infection, followed by larynx. It has a very short incubation period from 1 day till up to maximum 10 days. Initial part, fever is going to be very less, but sore throat, that is the most universal, or it is the most earliest symptom. Okay, not fever, only 50% will have fever, remember that. Okay, sore throat, just do a complete throat examination, use a tongue depressor, see for any membrane, that is very important. Only 50% will have fever. Okay, sore throat can be there, dysphagia can be there, hoarseness can be there, headache. So all these can be there, but sore throat is universal, 100% will have. Okay, so you depress and you see a membrane like this over the palate, soft palate, tonsillar area, it is going to be diphtheria in most of the cases, especially in an endemic country like ours. Okay, so this membrane can be either unilateral, one side, or it can be bilateral tonsillar membrane formation, and this can extend over the soft palate. It can extend into the posterior oropharynx area, even up to the glottic area. When you remove it, it will cause definitely bleeding, and you can see there is an extensive edema. Okay, outside, because of the regional lymphadenopathy, because of the cervical lymphadenopathy, the child will have a bull neck appearance also. When this membrane is going to extend downwards, is going to extend inferiorly, that is going to cause airway compromise, and that is going to be lethal. Right. So I told you it can, diphtheria can even involve the anterior nares. This is going to be very, very common in the infantile population. So the anterior nares can have a rhinitis, and that is going to be very erosive. Okay, so serous discharge will be there, or sometimes it can be a purulent discharge will be there. The anterior nares will start eroding, and there can be a membrane formation. So this is seen especially in infants. Laryngeal diphtheria, again, when the membrane extends into the glottis area, that is going to cause a significant risk for suffocation. So there, the airway is going to get compromised, and there will be local tissue edema also, and these children are in a high, they are going to be in a high risk for airway compromise. So these patients will need airway maintenance. Okay, and this laryngeal diphtheria is going to be the most common cause of overall deaths. So immediate establishment of an artificial airway for airway maintenance or airway patency is very, very important and life saving in these individuals. Cutaneous diphtheria, we discussed some part previously, that is, it is an indolent infection. We don't know where exactly the onset was, when exactly the onset happened. It is going to be an indolent infection, but these individuals are going to spread it to others. Okay, so it's a non-progressive infection. There will be a ecthyma-like illness, especially in the extremities, non-healing ulcer, grey-brown coverage. Okay, grey-brown membrane will be there, and it looks like an impetigo with some peeling of the skin and all. But this is going to be not responsive to antibiotics or what we are going to give for impetigo, and it is a very long standing illness unless impetigo. Okay, impetigo is a short duration illness, and these cutaneous diphtheria cases can be carriers of respiratory carriage of Corynebacterium also. And so the other clinical features, as I already told you, not just the respiratory mucosa, it can involve other mucosa. It can involve eye, so there can be purulent and ulcerative conjunctivitis. It can involve the ear, so it can cause otitis media. It can involve the genital tract, so there can be vaginitis, vulvovaginitis is common.